We're also reopening the Solarize Philly program today so that Philadelphians can continue to benefit from the savings, resilience, and economic development made possible by solar energy. All property owners in Philadelphia can sign up at solarizephilly.org. That's solarizephilly.org. Solarize Philly now includes a solar savings grant program for low and moderate income households, as well as a solar rebate program. We encourage everyone to take advantage of the virtual Earth Week events taking place this week by following hashtag EarthWeekPHL on social media. We applaud our employees and partner organizations that continue to advocate for a healthier and more sustainable planet. Philadelphia's single-use plastic bag ban, which I signed into law in 2019, is a major advancement towards cleaning up Philly's environment and our city streets. This law bans single-use plastic bags in retail establishments with certain exceptions. Since signing this legislation, a multi-departmental team has been working to implement the law. Much outreach is needed to make sure that residents, visitors, and retailers all understand the importance of the plastic bag ban and how to comply. Today, I have some updates to share on this work. Due to our ongoing response to COVID-19 and our commitment to ensuring that businesses are as supported as possible when they reopen, the ban's initial effective date of July 2nd, 2020 is no longer realistic. As a result, we are pushing back the effective date of the single-use plastic bag ban to January 1st, 2021. This is not an announcement we want to make during Earth Week. We know the climate crisis and plastic pollution remain two very serious threats to our planet and society, even during a global pandemic. Therefore, we thank our businesses and environmental partners for their cooperation as we revise the implementation timeline of this ban. This Earth Day, I also want to remind everyone that littering on our streets is never acceptable. Our sanitation crews are on the front lines of this pandemic, working day in and day out to handle the increasing amount of rubbish created by the stay-at-home order. It is never okay to throw trash on the ground. My mother would wring my neck. This includes disposable gloves, face masks, and other personal protective equipment. To keep our sanitation workers safe, all trash should be discarded appropriately in a trash receptacle. For household trash and recycling, residents should use a bin with a lid and always make sure bags are tied tightly. I want to thank our sanitation workers and thank our residents for their cooperation as we work to keep our neighborhoods clean and green. I will now turn it over to Dr. Farley for his daily update.
Good afternoon. The situation with the coronavirus epidemic is similar to where we've been in the last few days. Since this time yesterday, we've had 615 new cases reported to the health department, bringing us to a total of 10,643 cases in Philadelphia residents since the beginning of the epidemic. And that 615 number is very large. It may be the largest I've reported here in any of these press conferences, but many of those actually represented cases that were reported to the state health department previously, but the county of residence wasn't known. And so since that time, the data's been cleaned up and they've been identified as Philadelphia residents, so they've been reclassified as cases that belong in the city. Some of those are from more than 10 days ago. So that's a large chunk of that 615. Nonetheless, this still represents probably more than 400 new cases that are relatively new in the last 2 or 3 days for the city, which is about average of where we were. It means that the peak of the epidemic is actually higher than what we previously thought. If you look at the graph on our website, you can see that, but we're running pretty much level to where we've been in the last week or so. Again, check the graph on the website if you want to get a better sense for our trends. We're continuing to see clusters of this infection in congregate settings. The cluster in the jail now has 53 inmates with the active infection. That includes 5 new positives and 6 others who have recovered and been removed from isolation. I do have to report there are now 29 new deaths since yesterday from the coronavirus infection, bringing us to a total of 423 since the beginning of the epidemic. That 29 is about average of where we've been on a daily basis for the last week or so. Again, for better sense of trends, check the graph on our website. Of the 423 total deaths, 220 or 52% were nursing home residents. So nursing homes continue to bear the brunt of this epidemic. We're continuing to see increases in the number of cases in hospitals. As of this morning, there were 949 people with coronavirus infection in Philadelphia hospitals, 1,824 in hospitals in the entire Southeast Pennsylvania region. So that's a continued increase over the past few weeks. Overall, still, we have 31% of our general hospital beds that are still vacant and 26% of our intensive care unit beds that are vacant, which means we have plenty of capacity region-wide, but some hospitals have been much harder hit by this than others. And so hospitals have been transferring patients from one to another in order to manage the load. The Leah Core Center Field Hospital we've set up is open and operating. As of this morning, there were 6 patients that are being treated there. We expect we may have more patients come in today. Our testing availability is pretty much as it was before. We're still limited by the number of swabs that are available to collect the samples, by our laboratory capacity to run those samples, and by delays in reporting from some laboratory tests. But the testing is still available. If you go to our website, phila.gov/COVID, you'll see links and phone numbers to the sites where tests are available. I thought I would just back up a little bit because we haven't talked about this for a bit about for whom we recommend testing. We're recommending it for people who are healthcare workers or those over the age of 50 who have symptoms. We're not recommending it for people who don't have symptoms, although I know there's a lot of interest in that. And here's the reason why. The test only tells you if you have infection at that moment. It doesn't tell you whether you've been exposed. It doesn't tell you whether you're in the incubation period for this infection. So you may have a negative test today if you have no symptoms, and then tomorrow you may turn positive and not know it. So it may give you a false sense of security. We're also not recommending the test for people who are otherwise young and healthy, say a 30-year-old who may have classic symptoms of this infection, because it doesn't change our clinical management. Most people with that infection are going to do fine without any specialized treatment. If anybody with this infection is having difficulty breathing, then they need to call their doctor or go to a hospital emergency room, and they'll get treatment for their symptoms for that complication of the illness. But the diagnosis isn't really going to change that at that point. And if people do have a positive test, do have this illness, they ought to stay in isolation so they don't pass the infection on to anybody else. But we're recommending everybody stay away from anybody else. So it doesn't really change our infection control at this point. So because we have such a limit on the availability of testing, we're really trying to reserve it for those people for whom it's most important. Again, that's healthcare workers, that's people over the age of 50 who we think may have this illness. Overall, with the epidemic, I'd say our level case count continues to indicate that we're making progress with our social distancing. We're no longer seeing the sharp increases we saw in the past. Still, though, over 400 cases a day is many cases. The virus is still out there. And the best tool we have right now is still this social distancing, preventing spread by keeping a distance from other people. For the most part, this is how you spread it, by being in close proximity to somebody else. So if you stay inside, then you're not going to be exposed to people outside your household. If you have to go out for work or to the grocery store, keep your distance. And if you have to be around people, wear a mask. More information on this is at www.phila.gov/COVID, or medical questions can be answered at 800-722-7112. Now, the mayor mentioned that today's Earth Day. And so I thought I'd talk a little bit about the health implications of what's going on right now relating to air pollution, because we've had an awful lot of bad news. It's nice to talk about some good news. Today, the health department is putting out a report on air pollution trends since we had the stay-at-home order. With the stay-at-home order, people are driving less. They're driving an awful lot less. We know that vehicles are the largest source of air pollution in the city, probably in the country as well. So since the stay-at-home order was put in place in Philadelphia on March 17th, we've seen a reduction in air pollution in the city. The fine particle air pollution, the small particles that can get down in the small parts of your lung, that's down 18%. Nitrogen dioxide, down 22%. Carbon monoxide, particularly what comes out of cars, down 25%. So that means that the stay-at-home order, which is not something we can continue forever, but it has benefited us with healthier lungs and healthier hearts. So when this is all over, we're going to need to find ways to continue that by keeping our vehicle pollution down. That means people using cleaner vehicles, like switching to electrical vehicles, and also people driving less by making it easier for people to walk or bicycle or take public transit to get around or go to work. So that's the update for today. Now I'll turn it back to Armando.
Mensaje del alcalde Jim Kenney para el día miércoles 22 de abril del año 2020. Buenas tardes a todos. Hoy quiero tomar un momento para reconocer el 50 aniversario del Día de la Tierra. Muchos de ustedes saben que en 1970 los jóvenes de Filadelfia organizaron la primera Semana de la Tierra en el país. La serie de demostraciones y talleres durante esa semana se convirtió en parte del movimiento nacional del Día de la Tierra en el que actualmente participan más de 20 millones de personas en los Estados Unidos y muchas más alrededor del mundo. Gracias a esta organización colectiva se creó la Agencia de Protección Ambiental, que aprobó la Ley del Aire Limpio y muchos otros componentes de la legislación ambiental. Y Filadelfia continúa liderando en esta materia. Seguimos buscando implementar la ambiciosa meta de reducir nuestra huella de carbono. Y de esa manera, y como parte de este aniversario, nuestro Departamento de Parques y Recreación continúa con la serie virtual Parks and Rec at Home en Facebook para celebrar la Semana de la Tierra. Adicionalmente, hoy estamos relanzando el programa Solarize Philly para que los habitantes de Filadelfia puedan continuar beneficiándose del ahorro y el desarrollo económico derivado del uso de la energía solar. Todos los propietarios de Filadelfia pueden inscribirse en solarizephilly.org. Solarize Philly ahora incluye un programa de subvención de ahorro solar y un programa de reembolso para los hogares de ingresos bajos y moderados. Invitamos a todos a que aprovechen los eventos virtuales de la Semana de la Tierra de esta semana, siguiendo al hashtag Earth-Week-PHL en las redes sociales. Aplaudimos y les agradecemos a nuestros trabajadores y a las organizaciones aliadas que continúan abogando por un planeta sostenible que sea más saludable. La prohibición de las bolsas de plástico que se usen solo una vez en Filadelfia, que se había anunciado el 2019, es un avance importante en el cuidado del medio ambiente y de las calles de la ciudad de Filadelfia. Esta ley prohíbe que las bolsas de plástico de un solo uso en establecimientos minoristas se utilicen, con ciertas excepciones. Es necesario coordinar el trabajo de varios departamentos de la ciudad para que los residentes, visitantes y comerciantes minoristas entiendan la importancia de la prohibición de las bolsas de plástico y cómo cumplirla. Hoy tengo algunas actualizaciones que compartir sobre este tema. Debido a nuestra respuesta continua al COVID-19 y al compromiso para que las empresas reciban el mayor apoyo posible cuando vuelvan a reabrir, la fecha para comenzar este programa del 2 de julio del 2020 ya no es realista. Por lo tanto, la nueva fecha para la prohibición de las bolsas de plástico de un solo uso ahora es el 1 de enero del 2021. Este no es un anuncio que queríamos hacer durante la Semana de la Tierra, porque sabemos que la crisis climática y la contaminación siguen siendo dos amenazas muy serias para nuestro planeta y para nuestra sociedad, incluso durante la pandemia mundial. Por lo tanto, agradecemos la cooperación de nuestras empresas y aliados ambientales mientras revisamos el cronograma de implementación de esta legislación. Este Día de la Tierra también quiero recordarles a todos que arrojar basura en nuestras calles no es aceptable. Nuestros equipos de saneamiento están trabajando día tras día para manejar la cantidad cada vez mayor de basura acumulada desde que se anunció la orden de permanencia en casa. Nunca está bien tirar la basura al suelo. No es aceptable tirar al piso guantes desechables, mascarillas y otros equipos de protección personal. Para mantener seguros a nuestros trabajadores de saneamiento, toda la basura debe desecharse adecuadamente en un recipiente de basura. En el caso de la basura doméstica y artículos de reciclaje, los residentes deben usar un contenedor con tapa y asegurarse siempre de que las bolsas estén bien atadas. Quiero agradecer a nuestros trabajadores de saneamiento y a nuestros residentes por su cooperación mientras trabajamos para mantener limpios nuestros vecindarios. Y esta es la actualización en cuanto a materia de salud para el día miércoles 22 de abril del 2020. Desde ayer se han confirmado 615 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 10.643 casos en la ciudad. Muchos de estos casos no indicaban la residencia conocida y ayer se determinó que pertenecían a Filadelfia y lamentablemente el pico de la epidemia es más alto de lo que se pensaba anteriormente. Por lo general, nos encontramos dentro del promedio diario de casos de la semana pasada. Tenemos 5 casos positivos del COVID-19 entre los reclusos, con un total de 53 casos registrados y 6 internos que se han recuperado satisfactoriamente. Y tristemente, hoy reportamos 29 nuevos fallecimientos en Filadelfia. Hay un total de 423 personas que han fallecido por el COVID-19. 220 muertes se han producido en hogares de ancianos. Este virus no discrimina por raza o género y tenemos que ver que hay personas hospitalizadas en el área de Filadelfia y 1.824 en la región sureste de Pensilvania. Los suburbios también continúan agregando y tenemos un 31% de camas y 26% de unidades de cuidado intensivo que están disponibles en la región. El Liacouras Center está operando y atendiendo a un número pequeño de pacientes. Hay limitación en cuanto a la cantidad de pruebas disponibles debido a la escasez de hisopos para recolectar muestras y a la capacidad que tienen los laboratorios para poder procesarlas. Usted puede encontrar mayor información sobre los centros de pruebas en fila.gov/COVID-19, pestaña FAQ. En general, todo indica que hay un crecimiento muy lento en los casos. Sin embargo, todavía los hay mucho. La mejor recomendación de este momento para prevenir la propagación del virus es mantener la distancia social porque el virus sigue circulando en nuestro ambiente. Si debe salir a trabajar como trabajador esencial o a comprar al supermercado, le recomendamos lo siguiente. Mantener la distancia social de 6 pies. Usar máscaras de tela en lugares públicos donde sea difícil cumplir con las medidas de distanciamiento social. Lavarse las manos apenas llegue a casa. Y le invitamos a consultar el sitio web para mayor información. Este sitio es el www.philadelphia.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112 y esta llamada es gratuita. Juntos remontaremos esta tormenta. Muchas gracias.
Thank you, Armando. We are now going to move to our Q&A portion for the members of media who are logged in today. I'd like to ask our speakers to join us again with your audio and video. And please remember, we have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able, and we will unmute you one by one to answer your questions. First up, we are going to Jeff Cole with Fox 29. Jeff?
A series of questions for Dr. Farley. Dr. Farley, again, you've said that nursing homes are bearing the brunt of this. It almost seems as if nursing home patients are sitting ducks, that they are, they're almost defenseless against the march of the virus. Are you able to offer recommendations to nursing homes to try to protect their vulnerable patients?
Absolutely. There are recommendations that the Centers for Disease Control has delivered to them. We are also working directly with nursing homes and have been since before the virus even arrived here about the infection control techniques, how to avoid getting the virus in the facility in the first place, and if it gets in, how to prevent it spread in there, how to treat people. We've been working closely with them. We're trying to figure out how to step up our relationship with them, but it's really tough. Everybody around the country, we're hearing about this problem. We haven't been able to solve it yet, but we are absolutely working as hard as we can to try to slow the spread in those homes.
Why? I mean, obviously it's tough because these folks are living in close quarters and they're vulnerable in terms of their health. Is that obviously it?
Yeah, no, there's just those two big factors. One of them is that any congregate setting, any setting where a lot of people are living together, it's easier to spread the virus from one person to another, no matter how good your technique is. And then we know that people who are elderly and people who have chronic medical conditions are more susceptible to having a severe infection. So you put those two combinations together and it's really tough.
Last question. So we've also been hearing that nursing homes are struggling to get the proper PPE. They're almost last in the line of getting it. And secondly, many of their workers are low wage and that their communities are disproportionately impacted by the virus. Could you speak to that?
Many of the workers are in fact low wage and it's difficult for them. Many nursing homes have difficulty maintaining staffing through this. But as far as PPE, we have had them as our top priority. We have delivered surgical masks to all the nursing homes to make sure that they have enough. Our recommendation is that staff wear masks all the time. So just under the situation that a staff member may have the infection and not know it, that protects the worker, protects the residents rather. So yeah, we are and will continue to deliver PPE specifically to nursing homes and try to protect them.
Thank you.
Thank you, Jeff. We'll now go to Mitch Blocker at NBC 10. Mitch?
Thank you. I have a couple of questions for Dr. Farley as well. Dr. Farley, the president says that states are in charge of getting testing supplies. Have you had any luck getting supplies from the state?
No, but I wouldn't expect to be getting supplies from the state. The testing supplies are made by a small number of manufacturers across the country, none of which, as far as I know, are in Pennsylvania. So that there's nothing that the governor of Pennsylvania can do to increase the amount of testing supplies. This is a national problem. It needs a national solution.
Yesterday, you said that you ordered 10,000 nasal swabs and have so far got about 500. Can you describe, I'm just curious, what is the experience like right now trying to secure testing supplies?
You know, there's only so much that we can do. We can contact the medical supply wholesalers and manufacturers directly and say, can you give us some? We can order them. We have ordered supplies. That said, we did order 10,000. We were given 500 and a promise that we'll get more later, but it's unclear when we're going to get more. And just, you know, anecdotally, I hear from hospitals that they order directly. They're having similar problems. They're getting some, but apparently the companies that manufacture these are only making so many. And so they're essentially rationing them across the country. So nobody has enough.
When do you expect you will get all the test kits and swabs that you have ordered?
That is a very good question. You know, we're weeks into this. I thought when we started that this problem would have been solved by now. I don't understand why it hasn't been solved by now. And I hope the federal government can help us solve this problem. We can't continue to control this epidemic flying blind like this with the testing, the small number of people who are testing now.
Thank you, sir.
Thank you, Mitch. We are now going to go to Shaira Arias with Telemundo. Shaira?
Hi, everyone. Armando, la pregunta sería, básicamente, oficiales de salud de la nación creen que hay una posibilidad de que surja otro brote aún peor, más fuerte para el próximo invierno. Yo entiendo de que ahora mismo se está lidiando con el que está sucediendo. Esto es algo nuevo y están lidiando con esto día a día. Pero si esta preocupación a nivel nacional ha motivado de que las autoridades ya empiecen a pensar en medidas que van a tener que tomar, cosas que van a ser diferentes para el próximo invierno.
Para resumir tu pregunta, si le preocupa a la ciudad el hecho que el coronavirus en el próximo invierno sea peor y qué medidas están pensando tomar para enfrentar una pandemia mayor, ¿correcto?
Sí, y que uno entiende que obviamente ellos están todavía lidiando con esto ahora, pero si ya esto ha, exacto.
Bien. The question has to deal with concern that the city may have about the fact that the virus could resurge or reattack in a worse manner next winter. I know that we are now dealing with what we have in front of us today, but what measures might be taken now or later in order to prevent or deal with the possible recurrence of the pandemic in the winter?
You know, there are people who are assuming that the virus is going to go away in the summer and then come back again in the fall or winter, because that's what influenza does and that's what some other respiratory viruses do. But this is a new virus. We don't know how it's going to behave. I don't think there's any guarantee that it's going to go away on its own in the summer, and I don't know if it's going to come back in the winter. We have to assume that the virus is going to be out there as long as people are in contact with each other. And so we have to continue the social distancing, and we're going to have to monitor every step along the way what the virus is doing. But anybody who says that they know it's going to disappear in the summer and we need to worry about next winter is speculating. We don't really know what the virus is going to do.
Nosotros no podemos saber exactamente cómo va a reaccionar este virus. No es necesariamente igual al virus de la influenza y no sabemos cómo se comporta todavía. Por lo tanto, tenemos que asumir que el virus va a permanecer en nuestro entorno y vamos a tratar de que la gente continúe observando las medidas de distanciamiento social por el momento, porque no podemos especular sobre lo que pudiera suceder.
La próxima pregunta es sobre los nursing homes. Ya él más o menos habló sobre esto, pero es simplemente si podría ser un poco más específico sobre las medidas que ellos le están sugiriendo en los nursing homes debido a que ellos son tan vulnerables y los números mayores vienen de los nursing homes, de cuántas personas son afectadas y quiénes son los que están falleciendo en números más grandes, son esa comunidad de personas. Entonces, si él pudiera ser más específico sobre las medidas que se están tomando en los nursing homes y cómo ellos están trabajando con el personal.
Given that the majority of cases and deaths are reported to be in nursing homes, what measures specifically can you mention are being taken into consideration? What specific measures in order to deal with it?
Well, so all the staff should be wearing masks all the time. All the staff and any visitor who, visitors are prohibited, but anybody who has to go to the facility, and every staff is screened when they come in to see if they have symptoms, have their temperature checked to make sure that they're not working while ill. Then there are specific practices they need to be engaging in with the residents when they're near and touching the residents so that they don't catch the infection from them or pass the infection to them. And then any resident who has symptoms, they test. And if they have a case in the nursing home, then they may test residents around them or expose to them at appropriate times. And we separate out, or they separate out, the residents who have a positive test from those who have a negative test to try to prevent spread from one to the other. That whole process is something they know about, they've been trained about, their guidance on that, but it's difficult to have the kind of meticulous technique that is needed to be done in order to prevent spread every single time.
Los hogares para ancianos saben que su personal tiene que usar las mascarillas en todo momento, también igualmente los visitantes. Ellos tienen que hacer un seguimiento para poder determinar en un cribaje quiénes resultan positivos o no, mediante una medida de la temperatura, y también hay prácticas implementadas ya que ellos tienen que cumplir, por ejemplo, cuando tocan a los residentes o en su entorno en general. Cuando tienen unas pruebas positivas, ellos saben que tienen que separar a esos residentes en un espacio y de una forma muy específica. También los áreas que ellos hayan estado y las áreas que ellos hayan tomado. El conocimiento es la mejor defensa y hay protocolos y capacitación que se les ha dado para poder enfrentar esto, aunque es algo difícil.
Ahora mismo, ¿cuántos exámenes hay disponibles en Filadelfia para las personas poderse hacerse el examen de COVID-19? Y en cuanto al hecho de que se pidieron 10,000 y solamente se recibieron 500, ¿cuándo fue que se recibieron los 500 y cómo lo tomó el doctor Farley el hecho de ver que no estamos hablando de que él recibió ni la mitad de la mitad, sino que recibió un porcentaje extremadamente bajito? ¿Y en qué viene eso colocando a la ciudad en cuanto a poder básicamente pelear con la propagación del COVID-19?
This next question for Commissioner Farley has to deal with the availability of testing in Philadelphia for COVID-19. I know that we had requested 10,000 tests, and we received about 500, which is much less than what was expected. Not even a half of a half. So we would like to know how many are available now in the city and what the city intends to do to fight the infection with lack of testing.
So one thing I want to make clear is that the numbers I gave you about how many of these swabs that we ordered have, that's how many the health department has. Hospitals and other providers can also purchase directly from medical suppliers, and they have been ordering and purchasing. But like us, there's a limit to how much they can get. And I don't have numbers of how many the hospitals and other sites have. Once you answer that, then I'll finish.
Quiero que quede una cosa claro, los hisopos que tienen los departamentos de salud son los que tienen en este momento, y a eso se referían esas cifras, pero las instituciones de salud pueden comprarlos directamente de las cadenas que los suplen a ellos, y por lo tanto no tenemos una cifra exacta de cuántas estén disponibles, pero son más de los que se mencionan.
And then during this time, when we don't have enough of these collection swabs and the laboratories can't do enough testing, there's a limit to how much testing is going to benefit the way we control this epidemic. That's why we have so much emphasis on the social distancing. When the number of cases goes down, and if the availability of testing goes up, then the testing can be more helpful in identifying cases and preventing spread from individual cases.
En estos momentos en los cuales no se encuentran suficientes insumos como hisopos para recolectar las pruebas, ni tampoco tienen los laboratorios la capacidad instalada para poder procesarlas. En estos momentos, lo que nos ayuda es tratar de mantener las medidas de distanciamiento social, esperando que al bajar el número de infecciones se pueda utilizar las pruebas de mayor forma para poder determinarlo.
Thank you. Gracias.
Thank you, Shaira. We're going to go to Laura McChrystal now with the Inquirer. Laura?
Hi. First, I have a question for Dr. Farley. When you mentioned that the number of new cases confirmed today means that the peak of the epidemic has been higher than previously thought, can you expand on that a little more? Is that just that the overall number of cases is higher? Can you pinpoint that peak to a certain day that we hit that peak?
If you look at the graph that we have on our website, you get a better picture of what I'm describing. We graph out the number of cases by date of report. And date of report is when the laboratory logs it in and saying we have done this test. We heard today about people who had a positive test, and the positive came out 10 or more days ago. Those results come from the laboratories, some direct to us and some to the state of Pennsylvania, where they may know that this is a resident in the state of Pennsylvania, but they don't know what county the person lives in. Later, when people have time to go through the data and then figure out who this person is and know their county residence is assigned to us. So in the past couple of days, a lot of that data has been cleaned up. And so we've had an increase during the time period, the first week or so in April. So those case counts are higher, those bars are higher. So right now, the bars with the highest numbers are in the first week or so in April. Now, we hope that since then, the numbers are down, but there's going to be a delay in reporting those numbers as well. So right now, our peak is there in early April. We hope it stays, that's the highest point, but we'll have to watch this further to see if the decline we're seeing since then continues.
Okay, thank you. I also have a question on how many individuals are currently quarantined at the Holiday Inn site, and have the other hotels been used yet?
There are currently, I believe, 72 at the Holiday Inn. We have used the Fairfield for a handful of first responders, but currently that is empty. We recognize that some of our protocols were probably overly stringent, and we're addressing those protocols and may have additional updates either tomorrow or Friday.
Even if you don't have updates now on what the updated protocol would be, could you explain what the existing protocol is for someone to be admitted to those sites?
Certainly. So a shelter or a healthcare provider may identify someone that they believe should be quarantined or isolated. So they could be isolated because they have tested positive or are showing symptoms, or quarantined because they have been in close contact with someone that has tested positive. That healthcare provider or shelter will contact the health department. The health department will go through a series of qualifying questions, and then assuming that they meet the criteria, they will be admitted into the Holiday Inn or the quarantine space. And some of those questions are really about what other medical needs the individual has. We don't have the capacity to treat significant healthcare challenges at the Holiday Inn. We don't have doctors on site. We can treat some mental health illnesses and some addictions, but not to the capacity that I think we would like to see. And so that's what's being worked on now, to see if some of those protocols, specifically around quarantine, should be loosened up in order to make sure more folks get in there and that we're meeting the need appropriately. So we're constantly in review of all of those issues.
Okay, thank you.
Great, thank you, Laura. We're going to go to Walter Perez with WPBI 6 ABC. Walter?
Hi, Mayor. A quick question. How much of a shortfall are you projecting through all this from the parking authority?
I don't have the parking authority numbers. We can certainly try to get some from them. We're working right now on our own budget and our own issues relative to revenue and cost. But we can certainly reach out to them and see if they have a number.
Okay, that's it.
Okay, thank you.
Thanks, Walter. We're going to go to Nina Feldman with WHYY. Nina?
Hello. I wanted to see if there was an update on where the city stands with contact tracing in terms of looking to staff an effort as such, and at what point that would kick into gear? At what number of cases would we need to get down to for that to be a strategy that makes sense?
Thanks for asking that question, because we haven't talked much about contact tracing here, and I think it's worth talking about that. So just to back up, the best way to control any contagious disease that you don't have a vaccine for is to identify the case, and then that person has the infection, and then learn who that person may have exposed, who we would call contacts. And then you take steps with those contacts to prevent them from passing the infection on to others. So if you can stop off the chain of transmission there, then you help the community as a whole. That whole process is called contact tracing, and something we've done in public health for the past century. Now, when COVID arrived here in Philadelphia, we started doing it as the cases started appearing. And we could handle it for the first couple of dozen cases per day. But now they're up to 400 patients per day. We can't do it. It just far exceeds the capacity of the workers that we have here. Now, the case counts, we hope will be going down soon. If they continue to go down and get down below, say, 50 per day, then we might be able to go back to contact tracing all the cases or most of the cases. We do think that contact tracing is essential to being able to safely reopen society. We have to try to contain this infection so that we don't have to live like this where everybody is separated from everybody else. We are working now to try to build a capacity to do the contact tracing for when the case counts get low again, but we will probably need assistance with that. People at Penn Medicine have contacted us, and they're interested in doing contact tracing and assisting us with contact tracing. We can use all the help we can get from organizations like that might have the capacity. Any organizations that like that want to work on that, though, we would want them to coordinate with that. So if there's any organization that wants to assist us with contact tracing when we get to that point, they should just contact us at covid@phila.gov, and we would want to work with them.
Okay. And is there any conversation about being able to hire for those positions in the future? I know that there's some capacity to do that work within the public health department already, but to be able to scale up at the level that maybe you're talking about might require more manpower.
Yeah, to scale up is going to require more staff, so we would need more funding from that. And so we would look for funding from several sources, including private foundations, including the state government, including the federal government, including the city. But let's recognize that the city has got deep financial problems. So we need all the support we can get in order to have enough staff either internally or working in coordination with us in order to do that contact tracing.
Sorry, I was muted. Thank you. That's it for me.
Okay, thank you, Nina. We're going to go to Connell Smith with the Temple update.
Good morning. This is for Dr. Farley. So as you said that there is less, there's still more beds in the hospitals around the area. Do you expect the number at the Leocora Center to increase or to remain relatively slow patient-wise?
I expect those numbers to increase. Right now, it's a very small number of patients. I can't tell you how much it'll increase, whether we make it to 30, 40, 50, or make it beyond that, because that really will depend on what happens to the epidemic overall. We know the number of cases in hospitals in the city and the entire region continue to rise. We haven't hit the top yet. So only when it hits the peak will we have a sense for that we've hit the peak at the Leocora Center.
Okay, well, that's all I had. Thank you so much.
Thanks, Connell. We're going to go to Natasha Brown with CBS 3. Natasha?
Hi, this question is for Mayor Kenny, actually, or Brian possibly, just in reference to the union that's now threatening a work stoppage tomorrow if SEPTA doesn't meet their safety demands. All of this in the midst of essential workers obviously needing mass transit to get to and from work and hospitals and things like that. Can you guys tell me a little bit more about what you're doing to avert that situation possibly?
Well, we're still working with them. My Deputy Mayor, Rich Laser, Deputy Mayor for Labor, is working with them to try to get this resolved in an amicable way. We don't have an answer yet. I think people should at least prepare for some alternative method just in case. But we're hoping that cooler heads will prevail and the union will get what they're looking for and SEPTA can continue serving the citizens.
In the meantime, all of our healthcare providers have contingency plans in place. to make sure that their essential workers can get to work. And we're working with our internal departments, the fire department, police department, as well as our other essential employees to make sure that we can provide transportation for them as well. But certainly will be some challenges.
All right, thank you very much.
Okay, thank you, Natasha. We're going to go to Pat Loeb with KYW. Pat?
Hi, a question for Brian. I understand that there's FEMA money available that would allow the shelters to do better social distancing than they're able to do under the current conditions that they're in. Have you applied for that funding?
We are applying for all sorts of additional funding. I'll have to look at that funding stream specifically. On social distancing, we have already put in additional measures to improve social distancing throughout our shelters. So we did not wait for FEMA funding to do that. We have implemented a number of measures to make sure that happens.
Could you tell me what they are?
Again, pushing beds apart from each other and continued masking of both those who are in the shelters as well as staff, and continue to work through a number of those challenges as we go forward. A number of shelters also have quarantine and isolation space, quarantine space actually on site. At this point, I don't believe we have any positive cases in our shelters at this point, although we certainly have in the past.
Thank you.
Thanks, Pat. We're going to go to Dania Henninger with Billy Penn.
Sorry, muting issue. My questions are, I guess, to Mayor Kenny about the restaurant industry, which is one of the hardest hit. I saw in some Inquirer reporting that some restaurateurs are asking if, like, as they start to reopen, if there's a potential to suspend or defer taxes like liquor by the drink tax or the soda tax. And I know obviously the city's finances are also in a tough spot. Yeah. Is it something you would consider?
Well, the problem is the liquor by the drink tax goes to the schools, and the schools will be facing a multi-$100 million deficit themselves that we knew was coming next year. And the soda tax, we want to continue to have as many children in pre-K as possible. I mean, part of the problem is that for all the advances we've made in education and preschool education, I don't want these kids sliding back into failure. So we certainly, everything's on the table for discussion, and I understand the restaurateurs' concern, but I also don't want to damage our children even more than they've been damaged already.
Thank you. Sure. So this is a separate way that restaurants might be able to get some assistance, or there was a study that showed that like airflow, HVAC airflow in a Chinese restaurant had a lot to do with the spread of the virus. And so even presidential candidate Biden had mentioned if restaurants start to reopen, they might need to reconfigure completely or might need to reconfigure HVAC systems. And that might be true for other places where people gather, like theaters, if they start to open. Would there be any assistance on those renovations that the city could offer?
The city's not, my hope is that the city is able to offer public safety, sanitation, libraries, and some basic services. I mean, we're not in a situation where, like Washington, we print money, they print it, we don't. We have to balance our budget every year by law. But again, I'm not an engineer or a doctor, so I would defer to Dr. Farley on the technical aspects of whether or not that reconfiguration is more helpful.
Sure, and I would love to hear if Dr. Farley has seen that study and talked about it. And do you think that the HVAC systems as they currently exist would be, detrimental, that we could, that when we open some things, they would might reconfigure?
I did see that study. I don't think it's clear how you would reconfigure HVAC systems in order to be able to protect people in that circumstance. The basic problem is you have a lot of people closely together for a long period of time. And so whenever we get to the stage of allowing restaurants to reopen, there'll have to be some sort of risk reduction steps they're going to have to take. I think the central ones will have to be that they're going to have to be fewer people per square foot in the dining area, and probably people wearing masks to the extent they can when they're eating. So it's going to be difficult. I don't know that HVAC renovations is going to be a central part of those risk reduction steps.
Great, thank you so much.
You guys get the best background too. The award.
Thank you. We are going to go to Kimberly C. Roberts with the Tribune. Kimberly. Kimberly, you just have to unmute yourself. There you go.
Okay, there we go. My question is for Dr. Farley. Dr. Farley, do you believe that the fighting the virus is having a mental toll on first responders and health providers because they're working long hours? Some of them are have a lack of protective equipment. They're worried about their own health, their family's health. What kind of mental toll would you say the virus is having on frontline workers? And are there healthcare services being, mental health care services being provided for those people?
I think this epidemic has taken a mental toll on everybody. It's tough on people who have to stay in at home. It's especially tough for workers who have to go to work and are concerned about being infected at work. And those people who are in the healthcare field, in close contact with folks who may get infected. It's absolutely tough for everybody. Mental health services have to be available. They are available. I can't give you the details. I'd have to defer you to my colleague, David Jones, the Commissioner of the Department of Behavioral Health.
Okay, and Mayor Kenny, would you like to add anything to that?
Yeah, I mean, obviously, I admire and I'm amazed at the fact that, first responders, hospital personnel, even not only just the nurses and doctors, but the people who do the food service, the people who clean the rooms, the people who are the escorts, pushing wheelchairs and the like, are all going every day to facing the unknown. I believe, I would think, and I don't know this for sure, that large medical institutions like Jefferson and Penn would have in-house some opportunity for their staff to talk to a professional about their stress and their upsetment. And I know that within Philadelphia, the Department of Behavioral Health has opportunities for our own employees to talk.
Thank you very much. That's all I have.
Thank you, Kimberly. We're going to go to Jenny DeHuff with Broad and Liberty. Jenny.
Thank you. I guess this question is for Dr. Farley. Could you speak a little more to contact tracing and maybe the specifics around that? I know some people are worried about invasion of privacy, constitutional rights. Would this be an elective thing? How would it work?
From a practical perspective, contact tracing is always a voluntary thing. So nobody wants to talk to us, we don't get the information from them. You can't force people to give the information. Under these circumstances, I think most people care about the people that they've been around. Often they're their loved ones or their friends or their colleagues. And so they want to give us information so that we can help protect those folks. But in the end, it always ends up being voluntary.
Okay, thank you. That's all.
Thanks, Jenny. We're going to go to Rudy Chinchilla with NBC 10 Digital. Rudy.
Hi there. Dr. Farley, this first question is for you. You mentioned staffing troubles at nursing homes. Can you elaborate a little bit on those issues and what is the city doing or what can it do about those staffing issues at the nursing homes?
I don't have numbers on that and I don't have details on it. I've just heard, anecdotally from nursing homes that they're having trouble getting staff to come to work. You can understand why. And that when their permanent workers don't come to work, they rely on staffing agencies. Those staffing agencies themselves are somewhat overstretched. We have, at a previous press conference, we have made a solicitation to our Medical Reserve Corps that any of the volunteers who are part of that corps who want to assist in nursing homes, let us know. And we have some Medical Reserve Corps volunteers that have been assigned. I'm not sure if they've started yet at least one nursing home or perhaps others. We'll continue to provide that as much as possible. And then we're in touch with nursing homes to say, what else can we do to help?
Okay, and sort of bouncing off that same topic, there's also lack of PPE at nursing homes. You sort of addressed this earlier as well. Can the city do anything about this lack of PPE at nursing homes, or is this just related to the broader nationwide shortage of PPE?
Well, we have delivered PPE to nursing homes, and we will continue to deliver PPE to nursing homes, specifically the surgical masks. We've gotten a large shipment of surgical masks. Nursing homes were the top of the list to get that. We're going to continue to deliver that PPE. We really want them to not have a shortage of PPE.
And then my final question is to Mayor Kenny. I know last week you said you talked about the policy of releasing inmates, sort of like they're treated like members of the general public once they're released from prisons. So that means they're not tested right away, right after they leave any of the Philadelphia prisons. Is the city reviewing that policy at all? Or
Brian can elaborate on this, but as Dr. Farley has said many times, if you're not symptomatic and you're not in a certain age group, you shouldn't be tested. If we tested everybody, hypothetically, you could test negative, and then 5-7 days later, you could turn positive, and you would think you had a negative test, which would kind of make you feel a little more invincible than you actually are. So we are testing people in our prison facilities, and we only test them when they're symptomatic, and then we isolate and try to get them better. If not, they've been released earlier through a petition to the court, and I don't know how many total have been released, but I think, Brian, do you know if it's 1,000 or more?
Yes.
Yeah. So I mean, we're down to the lowest prison population probably in our city's history.
And just to add, in addition to everything we're doing behind the walls, as people are released, we are doing our best to educate them with information about how they should behave and what steps they should take once they get home. I think we also understand that there are housing issues for some who are being released back into our communities. We're actively working on those issues at the same time.
Thank you, guys.
Okay, thank you, Rudy. We are going to go to Martin Pratt, Philly YBN.
Hey, thank you for doing this. 2 questions. Dr. Farley, when the testing kits and testing stuff becomes more available, will you consider creating some type of, as the mayor just brought out, weekly schedule, or because when you're testing once, you may find that you feel you're great, and then 5 or 7 days later, you have symptoms and you have been tested. Since the community of at-risk people, those higher infections like nursing homes, if we have enough tests, would you recommend or create some type of policy for high at-risk communities to be tested on a monthly or on a scheduled basis?
So if we had all the tests, if we had many more tests available, I would broaden our recommendations for who to be tested. The next population I would go to probably would be younger people who have symptoms, not so much for their health, but to identify those that are infected so that we can do the contact tracing and follow up and prevent infection spread to others. We might do more testing in institutions. I don't think testing people on without symptoms on a schedule makes a lot of sense, but you want people with any symptoms to be able to be tested quickly and then do the contact follow-up.
Okay. And the second question, this is for Brian or the mayor. Has there been any updates with regards to the cleanup of the schools, the lead and asbestos in certain schools?
I believe that's ongoing. Brian, if you have more details, please.
No, and Martin, if you can give me more specifics about it, or give Mike or Dina more specifics on what you're looking at. It is ongoing, so they are using this opportunity as a way to move forward. But if you're looking for more specifics than that, just let us know, and I think we can track it down.
I'll send an email. Thank you.
Great, thanks, Martin.
That's all I have.
Thanks, Martin. We're going to go back to Nina Feldman. Nina.
Thanks so much. Just quick follow-up, one more question about contact tracing. If there are at this time any digital tools that the city is considering or exploring using, whether it's a QR code setup or anything that's been done elsewhere?
No, there's a lot of talk about digital tools, and I think that they may be of real value to us. You still need people to do this. You don't have the digital tool to do this work on your own. There are no tools that we're using right now, but we are exploring what tools are out there and in development to see what we might use when we have more staffing and we've got our effort more organized.
Okay, thanks.
Okay, thank you, Nina. And that concludes our daily briefing. We will be back tomorrow at 1 p.m. Thank you all.